All right. Begin the head and neck assessment. I'm going to take a look at the face here. I'm going to take a look at just normal distribution, normal cephaly, no lesions that I note on the face. I'm going to feel through the hair here. Normal hair distribution, no lesions noted. Any pain when I'm doing this?
No.
Okay, no pain. All right. Next thing I'm going to do is I'm going to check cranial nerve 7. Take a look at my eyes, look at my nose. Raise your eyebrows like you're surprised. Good. Puff out your cheeks like a pufferfish. Good. Grit your teeth and open your mouth like this. Okay. Smile. Smile with teeth. Good. All right. No facial droop. No abnormal findings there. Good motor movement for cranial nerve 7. I'm going to check conjunctiva. Pull it down. Pink and mucosal health look good. The sclera, the whites of his eyes look good. There's no redness or yellowing. I'm looking at his pupils. They're about 3 to 4 milliliters in length bilaterally and round. I'm also looking at his irises. They are green. No abrasions or anything like that as well. Next, I'm going to be testing direct, consensual, and accommodating people reflexes. So first I'll do direct. Look at my nose. Keep your eyes wide open. Okay, good. Good. All right, now I'm going to do consensual. Bring the eye, keep them open. Don't blink your eyes. Good. And then I want you to take a look at this. I'm going to move it towards your nose. Good. All right, pupils are equal and reactive and round to light briskly, about 3 to 4 milliliters in width. And he also has accommodation, so we check cranial nerve 2 and 3. Both are intact. Good. All right, next we are going to do the cardinal gaze and planes of motion. So we're going to check cranial nerves 3, 4, and 6. We'll start with 6. Take a look at this. Follow with your eyes. Don't move your head. Cranial nerve 6 intact. Checking cranial nerve 3. Good. Checking cranial nerve 4. Good. 3, 4, and 6 are intact. Also, take a look at this. Again, accommodation is good. Comes down, narrows, and also constricts. Finger to nose test. Touch your nose. Touch my finger. Touch my nose. Touch my fingertip. Touch my nose. Touch your nose. Touch my finger. Good. No ataxia. Good cerebellar function there. Now I'm going to palpate the sinuses. I'm going to check frontal first. Checking maxillary, looking for any inflammation, any pain.
No.
Okay, very good. Next, I'm going to palpate the masseter. Clench your teeth. Good. Bilateral equal strength there. Temporalis muscle, bilateral and equal strength there. Testing cranial nerve 5, the facial or trigeminal nerve again. Next, I'm going to palpate his temporal mandibular joint. Bring your jaw forward like this. Go side to side. Okay. Back and forth. Is there any pain?
No.
No clicking noted. Within normal limits for the TMJ movement. Next, I'm going to do the olfaction test. Close your eyes, please. Close one nostril. What do you smell?
Cologne.
Close the other nostril. Keep your eyes closed. What do you smell?
Cinnamon.
Cinnamon. Good. Passes the olfactory test. Olfactory nerve is intact. The next one we are going to do is going to be the nasal mucosa and nasal septum. So tilt your head back. Close one there. Open, breathe in. Breathe out. Good. Good expansion and contraction. Good. Patent nares as well. I'm going to take a look up in the nares. Medial midline for the septum. Nose hairs, vis briae are present. No impaction, no blood or any abnormal findings there. We're going to begin the mouth exam. I'm going to verbalize using a tongue blade. But first thing I am going to do is have him open up and say ah.
Ah!
So I'm going to take a look, looking just all around, looking at the gums, oral mucosa. Gums are pink, moist, as they should be, no visible bleeding. Also, open your mouth again. Look at the top teeth and bottom teeth, checking their health. No missing or loose teeth as well. Next, I'm going to check hypoglossal nerve. Stick your tongue out straight. Stick it towards me. keep sticking out. I'm taking a look at the side, taking a look at the underbelly. No thrush present. Good equal distribution for the tongue. No shifting to one side or the other for cranial nerve 12. Put the top of your tongue to your top of your mouth. Top like this. Open your mouth. There you go. And I'm checking the frenulum at the bottom of the tongue, checking for lesions, making sure that's midline. And that is. Next thing I'm going to do is check cranial nerve 9, I believe. Yes, I'm going to check cranial nerve 9, greatest tonsils, and also make sure the uvula rings on phonation. So again, open up and say ah. Big, wide, stick that tongue out. Good. All right, bilaterally, tonsils are present. I saw the uvula vibrating with phonation. So glossopharyngeal is intact. Tonsils I grade a +1 normal. Now I'm going to inspect his auricles of his ear. If you want to come to this side, I'm going to check right here. Does this hurt?
No.
No lesions or anything like that. In line with the side of the eye. I'm just going to do it on this side as well. Bilaterally, they're equal. That's good to see. Next thing, check in the external canal for the ear. See some hair, not much cerumen, no impaction. Doing the same for the other side. Checking for cerumen within normal limits for that. Next thing I'm going to do is check vestibular cochlear nerve, cranial nerve 8. Listen closely. Can you feel me doing this behind your ear? Or hear it?
Yeah.
Okay, good. Doing it for the other ear.